Hello, I'm Lori Steiner, sitting in for Arvin Budish. Welcome to Golden Opportunities.
Today, can colon cancer be stopped? We'll alert you to the warning signs and prescribe preventions. Then, long-term care can also mean lots of money. We'll take a long look at how to cover those costs. Is your back bothering you? We'll speak healing words for your sore spine. And we'll reveal a new sinister government plan to cut Medicare coverage for nursing home stays.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Here's some good medical news. There is a type of cancer that is highly preventable, and we have the power to improve our odds. Which cancer is it? Colon cancer. Surprised? Well, Metro Health physician Dr. Jeremy Lipman might just have a few other surprises to share about colorectal cancer. Welcome to the show on this important topic.
Thank you.
Now, you said, and I introduced it as highly preventable. What does that mean?
Right. Colon cancer is one of the cancers that we can identify easily through routine screening and prevent. Getting a colonoscopy every 10 years once you hit age 50 is enough to identify polyps before they turn into cancer, get them removed, and prevent cancer from ever developing.
That's fantastic. How do you know if you need a colonoscopy? Do the polyps show symptoms, or is there something that will trigger you to think to do it?
They don't. There are no symptoms associated with it usually. Some people may see some blood in their stool, have some abdominal pain, but usually that's a sign that things have progressed. When you turn 50, then it's time to get a colonoscopy. Talk to your doctor and get it set up. If you have anyone in your family who's had cancer in their colon, then you probably need to be checked even earlier.
Okay. Is it covered by insurance? You don't have to worry about the big cost?
It's covered by insurance and easy to set up.
Okay. You just got to do it, huh?
Exactly.
So we have our first colonoscopy at 50, and you did mention to me that it should be age 40 for African Americans. They must have a higher incidence. Do we have to have one then annually, or how does that progress?
No, if your colonoscopy is normal, then you get 10 years free.
Oh.
So, and if they do find a polyp, then usually we'll look again sooner to make sure that nothing bad is developing.
Okay. What kind of risk factors or medical conditions might you be looking at your family for? You mentioned a few things, but...
Yeah, if your family has colon cancer, then that puts you at high risk. And if if you talk to your family members and find out that, they've had a lot of polyps removed too, then you should talk to your doctor about that.
Do other types of cancer lead you to worry that you might end up with colon cancer?
Yeah, there's some relation between people with stomach cancer, breast and ovarian and uterine cancer. People in your family that have inflammatory bowel diseases like Crohn's disease and ulcerative colitis, any of those things should get you to your doctor to have a conversation.
Okay. And if you do get in early enough and you get your colonoscopy, and it's clean, then you've got some time, but what if they do find polyps? What is the treatment procedure?
The treatment is done right at the time of the colonoscopy. We can remove the polyps and you leave there hopefully with everything gone. Now, if they do happen to find a cancer, having regular colonoscopies will help to find it earlier, and usually that can be removed with surgery, often done with small incisions laparoscopically.
So they don't have to cut you all open?
Usually not. Usually we can do it through the small incisions and get people home and back on their feet faster than doing it with the big incisions.
And does colon cancer necessarily mean they have to have that ostomy bag?
Oh, no. Yeah, usually not. Now, there are times when it's necessary, but for most people, for most cancers, that's not the case.
Oh, well, that's a good thing to think. You don't have to be all afraid of this whole process.
Exactly.
It's not so bad.
It's really not.
And since colon cancer is highly treatable, let's catch it early and stop it from happening.
Exactly.
All right. So, especially when it comes to cancer, it's nice to share positive news like this. And here's some more. Metro Health is offering a free information sheet on colon cancer. To order yours, use the information that's coming up next. My thanks to Dr. Lipman for joining us here today.
Thank you.
For a free information sheet on colon cancer, call Metro Health at 216-778-4131 or log on to www.metrohealth.org. Next, how will you cover long-term care costs?